We interrupt our regularly scheduled program so that we may bring you a KOMO 4 special presentation when it's an emergency. Stories from inside the Seattle Children's Emergency Room.
It's always open, always ready.
You don't know what's going to come in. You don't know how families are going to be.
He was having a lot of distress breathing.
24/7, 365 days of the year.
So there was a lot of blood, and so I just called 911.
The emergency room of Seattle Children's sees it all.
It's hard to see kids who are sick or hurt.
From heartbreak to hope.
Everybody always says, I just looked away for a second.
We take an inside look at the triage, the training, and the typical.
I felt it kind of bend, so I knew it wasn't good.
When it's an emergency, stories from inside Seattle Children's ER.
Good evening, I'm Molly Shen. Here we are at one of the best places you never want to go, the emergency department at Seattle Children's. It's where you'll find world-class pediatric emergency care you hope your child never needs. But plenty do need to come here. This ER had almost 40,000 visits last year. Tonight, we take you inside to see the inner workings of the emergency room of Seattle Children's. Inside doors that never close and never turn away a patient.
If there's such a thing as a typical day at the emergency department here at Seattle Children's, it usually involves some ambulance arrivals. Sometimes even a helicopter will deliver a critical case, like this tiny baby with big medical concerns. But no matter what comes in the door on any given day, the people who work here work very hard to keep this place from feeling like a primetime TV drama.
In order for us to provide the best care and the safest care and very detail-oriented care and mistake-free care, the best environment to do that in is not an environment where everyone's shouting out orders and running around. It's one of as much control as possible. We drill often. We want people to be practiced. We want people to be
I'm just going to listen to you, okay?
very attentive to detail and not distracted. And we want the family experience to be positive too.
Clinical Director of Emergency Services, Dr. Russell Migita, knows families who are here appreciate that environment in the midst of their personal crisis.
She had an event where she was submerged underwater.
The family of 5-year-old Alina Jennings will remember this day for the rest of their lives, the day they could have lost their little girl in a swimming pool in the blink of an eye.
They got her out in about 20 or 30 seconds, but she's been having difficulty breathing. She swallowed some water and vomited up some water, and that can lead to some difficulties, especially within the first 12 hours.
While emergency providers work with Alina, you can see the stress on her family.
It's pretty scary. She's going to go to our intensive care unit, and hopefully, and I believe that she'll probably keep breathing on her own, but she may need some assistance.
The patient and family experience is front of mind here every day.
They're looking just to make sure her blood gases stay good and that her lungs are good and that she's breathing okay and she doesn't go into respiratory distress.
Cases like Alina's show that you never know what the day or night may bring.
It's stressful and it's hard. It's hard to see kids who are sick or hurt, but we also know that it happens, and so the people who are here because they want to make a difference, and people who are here accept the fact that part of making that difference and being involved is dealing with the fact that sometimes there are very tough situations to deal with.
Oscar is just 2 days old.
He looks really, really good. He definitely is breathing fast, but he's not breathing with work. He's not working to breathe.
He's his mother's 3rd child, and her instincts told her his breathing didn't seem right.
Here you go, buddy. Here you go, Oscar.
And she thought she should have him checked.
He was having a lot of distress breathing.
Grandma agreed.
Right?
Well, I felt that Children's Hospital was the best place to go to make sure my little grandson was taken care of properly.
Oscar gets a thorough exam, including a chest x-ray, so doctors can find out what's going on with his breathing, from tiny newborns to teenagers.
I felt it kind of bend, so I knew it wasn't good.
A broken bone, a painful abscess that'll need to be drained, an asthma attack, All kinds of conditions and concerns bring worried families through the ER doors.
Let's look at his palms now and soles, because I know he already has a rash, but he may actually get another rash with this rash that's in his throat. Sure.
I think that something that we have to continue to be mindful of is the fact that even for patients who don't seem like they're here for a critical issue, it's the most important thing to that family at that time.
The early diagnosis for Oscar is extra fluid on the lungs that didn't get fully squeezed out when he was born. That explains his rapid breathing, which is, of course, concerning, but not uncommon.
But this is a really savvy mom who did all the right things and saw all watched for all the things that she needed to watch out for, and went to her primary care physician, and her primary care physician sent her here, so they have a good safety net, and the safety net worked for them. It's all serious to the people who are involved, but in the big spectrum of things, this is bread and butter pediatrics, and it's part of what we do, and it's part of what we enjoy doing. And the good thing about this is I think this is going to have a really happy ending.
Most children who come here do get a happy ending. Like Alina, who never stopped breathing on her own and now gets to move to a regular room for what will likely be a short stay. Mom pulled through too.
Oh my golly, I love this hospital. The staff is over the top, amazing.
It's another happy ending in a place where a typical day is anything but typical.
It's true that those who work here never know what the day or night may bring, but they do know that they'll be working with children, from tiny newborns to growing teens. This ER and all the people who work here are uniquely equipped to deal with children.
It's broken.
5-year-old Abigail Nelson took a bad fall at her preschool playground and landed in the emergency department of Seattle Children's.
She managed to break both bones in her forearm, and the bones are broken enough and they're displaced enough that we're going to need to put the bones back into place so she can heal properly.
Her x-rays show she really did a number on that arm.
So these are the two bones of her forearm, her radius and her ulna, and you can see there's definitely a fracture right in the middle of the bone on both sides. This is why we always do 2 x-rays, because this x-ray, you can see there's a fracture, but it doesn't look too bad. When we look at the x-ray from the side, you can see what normally should be a straight bone is quite angulated, and this is the part that really needs to be fixed, is those bones need to be straightened so she can heal properly.
Fixing Abby's arm doesn't sound very fun.
One of the most important things is that we try to make this as the least amount of trauma and pain for Abby as possible. So we're going to give her some medications that will treat not only her pain, but will help her basically fall asleep while we get it done. She won't be completely asleep, it's not general anesthesia, but she won't have any memory about what's going on, and she won't really be aware of what's going on in the room, but the nice thing is it's a very safe medication.
To get that heavy sedation, Abby will need an IV. Also not fun for a 5-year-old.
Knock, knock. Hi, guys. Is this Abigail's room?
Enter Paul Foster.
My name is Paul, and I'm our child life specialist that works here at the hospital. So I'm different than our nurses and doctors, okay? So my job here at the hospital is I help you understand what's going on and then try to make it a little easier and more fun. Does that sound okay?
Paul prepares Abby for what she can expect in a way that she can understand.
I'm here to help make their stay a lot easier. My job is to help assess how kids are coping with their emergency department stay, and I provide preparation, education, and for our younger kids, lots of distraction to help get them through certain invasive procedures. How's he been doing so far since you got in? Did he do okay in triage?
Paul is a child life specialist. All of the providers here are trained in dealing specifically with children, using comfort and distraction techniques that are appropriate to a child's age and situation. But Paul is the big gun called in when a patient needs that extra special touch.
So this is the small straw. You want to feel it? It's really soft. So Mom and Dad, this is an IV if you guys haven't seen one before. So what we do is we put the small straw inside one of our body's blue lines, and we can give you medicine through it, and it makes you feel all better. And it's gonna help take away the owies in your arm.
He doesn't hide anything from the kids. Rather, he educates them on what's about to happen and why in an age-appropriate way.
So sometimes kids ask me, they say, Paul, what is the small straw gonna feel like? Do you want to know what it feels like? Yeah. Kids tell me that it feels like a small pinch. I love the educational component. I love getting to educate kids about why they come to the hospital and what the staff are doing, because, you know, for a lot of people, you know, seeing the white coat come into a room is kind of a scary thing, but, you know, knowing that all the doctors and nurses here really love to help kids get feeling better and to educate them on, you know, why we do a blood pressure cuff and why we take their temperature and all those things. I like seeing that click in the child's eye of, oh, that's why they're doing that. And I really enjoy that. And you watch with your eyes and see if we find it.
Paul also uses distraction to help young patients through a procedure.
Is that the one?
Instead of Abby focusing on that IV about to go in, she's turned away, engrossed in a book that Paul brought.
Purple fish.
A broken bone, an IV. This is pretty typical stuff here in the ER, but it's a very big deal for Abby and her family.
A yellow frog, okay.
Abby being 5, it's important that I meet her where she is developmentally, understanding that she's not an adult and she doesn't necessarily want to know everything, but she wants to know everything that's important to her. So understanding what it is a 5-year-old understands and what it is a 5-year-old wants to know, at the same time providing an appropriate level of information for the parents who of course want to know everything. I want to make this for Abby, like I said, she's had a bad day. I want her to leave this experience with not only without trauma, but hopefully with a smile.
We're gonna give it to you right through your small straw, okay? So there's no more owies?
And it won't hurt when it goes through me.
Nope. Sometimes kids say that it feels a little warm, but no owies. Okay? Yeah. And then you'll wake up and your arm will be all fixed and you get to go home.
Yeah. But when I'm asleep, I can't talk.
That's right. And you won't feel anything.
Yeah.
Yeah, it was. It was really scary. It was.
The tumble 3-year-old Peyton took while vacationing in Seattle certainly scared her and her parents.
My daughter had a fall over at the Science Center into an open, what used to be, it looked like a little pond, and fell over the chain wall and hit her, busted her head.
But the time in the emergency room, even the stitches, really weren't so bad.
They brought in Paul, who helped her just kind of ease and made her laugh, and brought in bubbles and books and coloring and everything. So she was much more comfortable with that part of it. And then he came in and talked to Peyton and explained to her the process of what they were going to do, and so she could understand.
An ER visit as a child can set a lifetime attitude toward all things medical, good or bad. If this is a traumatic experience, patients could fear doctors, hospitals, even needles well into adulthood. Those who work here in the emergency department know the importance of making this experience as painless and positive as possible.
Are you still whispering? Yeah. Well, awesome. She did a great job, tolerated everything great.
Yeah.
So in terms of giving you advice for what to talk to her about at home, I can't think of anything because she did so well.
Okay.
But if questions do arise, usually she'll kind of express it through play.
Okay.
So just kind of keep an eye out through that.
We try to have a pain-free environment, so we always want to make sure patients don't have pain, but we recognize that a lot of the sense of pain is anxiety. And if we have people who are specially trained to reduce the anxiety, as are our physicians, our nurses, but especially our child life specialists, it makes a huge difference for the family. The children leave smiling and happy even after an invasive procedure.
Abby is waking up to an arm that's put back together so it can heal.
The doctors fixed your arm. It's all better now.
She's now excited about a pretty pink cast in her future and not at all upset by the day's events.
Bye, guys. Take care.
And Peyton heads home with some souvenir stitches and a smile.
Paul isn't the only child life specialist here at Children's. While he works in the ER, other child life specialists in other parts of the hospital help kids deal with surgery, cancer treatment, and hospitalization. Coming up, the top reasons for emergency room visits here at Seattle Children's. Can you guess what's number one? And how prevention can be the best medicine. What doctors are doing to keep you from having to come here in the first place.